The article for this week is What Ultimately Matters in Root Canal Treatment, Success and Tooth Preservation, a 25-year cohort study by Jin and others, published in International Endodontic Journal in 2023. This study aims to present the result of systemic data collection over a 25-year period with treatment success and tooth survival as measured outcomes. 1,545 patients for 2,500 root canal treatment were included. 1,063 were primary treatment and 1,437 were retreatment. All the patients who received an endodontic treatment by a single practitioner between 1990 and 2016. Treatment follow-up period ranged from 0 to 25 years. Complete data collection was achieved for 56.4% of the treatment. Periapical radiograph was taken before and after treatment. Different angulation was taken for multi-rooted teeth. Multiple data were collected before, during, and after treatment, including clinical, technical radiograph, and patient-related characteristic. In addition to that, follow-up assessment. Performing root canal treatment was indicated based on the possibility of placing a good corona restoration after treatment to allow the long-term span of data collection. Regarding the treatment, whenever possible, treatment was completed in single visit, and cases required multi-visit calcium hydroxide was used as intracanal medicament. Two outcomes were considered, which are the root canal treatment success and the tooth preservation on the arch. Success of root canal treatment was defined as the combination of clinical and radiographic success, which is a clinically absence of signs and symptoms, and radiographically a periapical lesion less than 2 mm was considered within normal physiological range, and lesion larger than 2 mm was considered disease. The tooth preservation, defined as the lack of tooth extraction during the follow-up period. Any tooth classified as a failure of root canal treatment, whether it's required non-surgical or surgical treatment, or no further treatment was carried out for medical reason or by the patient decision. All of these were taking into consideration for the tooth preservation outcome. The results showed that variables were not identified as significant on outcome are primary treatment or retreatment, presence of sinus tract flare-up, presence or removal of the post-treatment period, single or multiple visit, type or size of instrumentation, and type of root canal filling. Regarding technical variable, the presence of existing complication before treatment was significantly effect on tooth survival, such as perforation, canal transportation, or fracture instrument. Tooth type was significantly associated with both outcomes. Incisors were the least successful group regarding treatment success, while the molar were the least regarding tooth survival. The size of periapical lesion was highly associated with treatment failure. The larger size, the higher the probability of failure, so the fate of teeth after failure of root canal treatment was the main reason for tooth loss. Greater than 50% of teeth were extracted due to non-restorable tooth fractures, and 25% were related to prosthetic and periodontal consideration. The probability of a treatment success and tooth survival at 20 years was around 60% and 50% respectively. In conclusion, what ultimately matters in root canal treatment success and tooth preservation in this study. The first is the importance of follow-up time, and the second, a small proportion of predictive variables, most of them being disease and patient characteristics.